Hello, this is Florence May at TRS, part of the Volunteer Management Systems Professional Volunteer Management Webinars, and we will be starting in just a few minutes. We've got quite a few people joining on the waiting room, and I will open up with initial comments here in just a few minutes. Okay, to keep this on schedule, this is Florence May at TRS, TRS Volunteer Management Systems, and we are conducting a series of professional volunteer management webinars. Many of the participants on the call today are TRS clients, but some of you aren't. Some of you have worked with me in other areas, professional sporting events. Let's see, oh, so many different items, festivals, conferences, conventions, wide variety of events. I will note that we are recording the session today, and we are going to be talking about the reality of event volunteers returning during the time of coronavirus. The uncertainty of the situation, but also we're going to be talking about the opportunities that exist during this time frame. If those who are on, if you could if you'll scroll over the bottom, if you want to hit chat and just confirm that you can hear me and that you can see the PowerPoint screen, that will just allow me to know that I'm not talking to myself and that you can actually see the reality of what we're showing here. So appreciate that. Excellent. Okay, thanks so much. Oh, and good to see so many friends and clients on. Love it. Okay, so if you're having any challenges, we are, as I said, recording, and we will make the recording available on our website after the session is over. So we're going to start with the hardest slides. We're going to start with the reality of where we have been and before we get into where we're going. So we know the counts change every few hours. Actually, since I pulled this morning, the numbers have increased, both globally and here in the United States. We can debate who is counting, we can debate who is counting accurately, but I think what we can all agree on is the outbreak has created a tremendous medical challenge, and it's created a tremendous economic crisis for all of us. I had a call with a banker back a few weeks ago, and they were talking about small businesses and that the majority of them have been hit partially, that they're not completely taken down. And he asked me what the scenario of TRS is. And I said, oh, 100% of events have been impacted by this. So I know all of you are looking at that realm and looking at the reality of the next slide as we look at, depending on where you're at in the country, this may have impacted you in very different ways. If you're in the white state, one of the white states, they never issued stay-at-home orders, so that's why there are no colors. But if you did a statewide lockdown, if you did a partial lockdown, if your state's reopening, if your state is now pulling back and reclosing portions or moving ahead more quickly, wide variety of scenarios here. And so depending on where you live, the crisis obviously may look and feel very, very different. But the reality is all of our events have been affected by the outbreak. We've had cancellations, we've had postponements, we've had rescheduling, we've gone to virtual events, we've had some that have rescheduled again already, just a wide variety. And so what has been consistent? The consistency has been change, frustration, and uncertainty. So as we look at those pieces, let me talk to you just for a few minutes about who I am and how I'm coming to these various pieces. Many of you know I'm Florence May. I'm the president of TRS. We provide volunteer management solutions to, as I said earlier, very wide variety of large events, sporting events. We've got many Special Olympics clients on the call today. We have many festivals on the call today. We have many wide variety of events, from conventions and conferences, youth, seniors, people who are in their middle age, all over the place in terms of the type of events that are being supported. TRS, as the pandemic started, we started getting calls from clients, and we started getting calls from sponsors who let us know that there were going to be challenges. Some of the sponsors were going to have to reduce, sometimes financially, but sometimes the number of volunteers that they were providing. And they were reaching out to us and to clients to say, need everybody to be aware that we are going to have to pull back our resources. We heard from hundreds of clients as we went through this process the last few weeks, and we learned a lot. I don't want to say we come to this as experts beyond anyone else, simply that we have just listened to so many of our clients and so many people. So I want to share today what we've learned from all of those calls. What we do know is everybody is making hard choices right now. We know that we went from a world where we were all in groups and given hugs and taking selfies to a world where we're wearing masks and gloves, and there's been some real evolution in the way our volunteers are thinking about volunteering. We've got some people who are very worried. They're concerned. They are very much still in lockdown mode and are taking the wait and see approach. We've had a number of events, and a number of our industry partners have sent out surveys. I'm going to talk about that in just a few minutes, but really gauging where volunteers and vendors and participants are on coming back and participating. And they're seeing a wide variety of impact. We've got a lot of volunteers. People volunteer a lot of times because they enjoy the networking. They enjoy the contact. They want to help people. And they want to be in the heart of what is happening. They have a love for their community. And so some of them feel trapped at home, and they're wondering, when can I get out help? How do I help? How do I move forward? So many of you may have been playing the Corona Bingo game and trying to deal with kind of the day-to-day changes. And we know that's where our volunteers are. Maybe they're working from home, or maybe they're retired and they were home to start out with. Maybe they're learning to use Zoom. Maybe you're learning to use Zoom or another online content sharing tool. You may have changed a lot of things in your life. You may be homeschooling kids, you may be homeschooling grandkids, and your volunteers may be in the same boat. We have some people where we talk about this I'm essential category, where they are working prolonged hours. I know at TRS, while I don't know that we fall in the essential category, we like to believe we're essential to our clients. We have been working nonstop since the coronavirus outbreak started, and there are many volunteers, many clients, particularly those people who are working in the medical field and on the food side of the business that they are working nonstop. There are other people who are at home and maybe they're working nonstop, but they're also trying to balance the children. They're also trying to balance having spouses who are also home and dealing with unusual situations. So while this slide, of course, is a little bit of a joke, what did the reality of this play out with? So we started to see very quickly online people who wanted to help, people who wanted to provide assistance and do something. And we've seen everything from people making and donating face masks to, I have a lot of friends who are fostering shelter animals right now, people who are out donating blood because there is a very substantial blood shortage. And as we look at all of these different pieces evolve, we saw a lot of these options start to test how we get back out into the community, whether it was food pantry operations, or whether it was the donations of blood, or the many other changes that were occurring. We started to see some real testing of how do we get online and do things in a more virtual way and with social distancing. We started to see volunteer challenges. We started to see organizations, whether it was the NCAA, who reached out and really created a online wellness challenge, to we've seen a large number of organizations who have started collaborations. So we saw at food pantries challenges with, we really need more volunteers because we are providing food for so many more people, but we can't accommodate more people on site. And the reality is we're concerned about bringing in people we don't know. Have they taken proper precautions? Are they healthy? They're people we don't know. And I really heard this as we're talking about the Pack the Pantry program. We had a call where we had 30 different volunteer organizations on the line, all of them telling me we need more people, we need more people. But then stepping back and saying, oh, okay, well, maybe we need to step back just a little bit and let's look at what we can do to help in a different way. And in an online call of a group of people who would very bluntly tell you they had never been on Zoom before, I think our first meeting started 25 minutes late as we were getting everybody online. And I know everybody on here has had those experiences. We came up with a creative solution that we saw the local action committee, we saw Winterfest, we saw the American Legion, and we saw two towns come together and say, we're going to get our community to go out and put together bags of food. So everything's already pre-packed when it gets to the food pantry. We are going to ask for some additional items, and then we're going to have, when people pull up to donate food, we're going to have them stay in their cars. We're going to have our volunteers in their masks with gloves, open the trunk and take the food and move this in a more expedient way. So it allowed people to do things from home. It allowed some virtual connection, and it decreased the number of people who were needed on site. Now, are we going to be able to solve all of our volunteer problems like that? No, but it's a case study in, and I wish I actually had pictures of this from the beginning, looking at the two largest food pantries in the area, and there was just food everywhere. People had donated plenty of food. It wasn't a problem of not having enough food. It was the manpower and the time to be able to get it all organized, and really looking at, so how do we do this in a more clever way and pre-pack? So as we're looking at that, I wanted to start with this as an example because as we see the return of the volunteer, many of you are going to be facing unique challenges. You're going to be looking at that problem of, I don't know if it's going to be too much food all sitting in one place, but you're going to be looking at the unique issues of your events and your activities and saying, how do we do this differently? How do we create an atmosphere where volunteers want to return and want to come back to us because they feel confident? And what is going to make them feel confident? As we look at cases decline, people will start to feel more confident that that maybe the problem is not getting worse and worse and worse, that maybe there's an opportunity for this to be resolved. And as communities demonstrate and companies demonstrate that they have the health of the community, the health of their workers, and as we look at nonprofit organizations, that they have the health of everyone, their employees, their volunteers, their vendors, first in their hearts. And as events reemerge, the reality is, yes, they may look and operate differently than pre-crisis. So how do we really engage the volunteer in that discussion and understanding what is going to work for them? So as we look at the new normal, we're going to be talking about heightened public health awareness. We're going to be talking about paying attention to social needs and those evolving requirements that are coming. And what is social distancing going to look like? I will tell you that I took the day off yesterday and I went up to a beach in northern Indiana, and it was very interesting because a portion of the beach there was great social distancing going on, and people were very respectful. People were not sitting, they were walking, they were moving, and they were maintaining proper distance. And then as the sun came out and we looked at the main beach, it kind of fell apart. And you didn't see people maintaining distance, and there really weren't elements in place to encourage people to do so. So those are topics that we're going to be discussing. So let's look a little further into the volunteer. We've got the volunteer survey here, and Volunteer Match, which you may be familiar with. They match organizations like TRS. They'll take all of our events and they'll match it with specific people in specific geographic areas. They did a look in March. So this is not completely up to date, but there aren't a lot of good surveys right now on Volunteer Match. There are some other links that I will send when I send out this this particular recording, and there are a few others. They're not maybe as direct in terms of observation to volunteers as this one is. Most of them are focused more broadly on nonprofits. But in this particular case, certainly had a good solid number of responses, more than 1,000 comments from a wide variety of representatives. And they were really looking at 93% of nonprofits had already reported heavy reductions in terms of volunteer participation, discussing what percentage of volunteers are afraid of getting sick. And as the majority of volunteers right now are in the more mature category, this makes complete sense. But you go back to what I was talking about earlier. You've got a large percentage of people, half, who still want to help in person. And then you've got a little less than that people who want to volunteer virtually. And so we're going to chat a little bit about that. So as we look at what are the opportunities to flatten the curve and how do we explore some new options in terms of moving forward into this piece, I do want you to take a minute and really think about what are you doing to engage your volunteers. Have you adjusted your plans? Have you looked at a volunteer engagement plan? Are you collaborating with other nonprofits? Have you developed a social media challenge? Have you developed any virtual volunteer projects? So what's the real question here? Have you engaged your volunteers during this period? And I will just tell you that when 2.5 weeks ago, I did a very similar webinar for the International Festival and Event Association. And I'll tell you about a third of the respondents, we ran online polls for that one, and about a third of the respondents indicated that they were doing something and gave examples of the types of opportunities. And it was pretty broad in terms of that spectrum. About a third of them came back and said, we're thinking about it, we're trying to figure out the right way to do it, but we've got internal challenges that we're dealing with in terms of just trying to decide where we're going. And a third came back and said, had not even thought about this. And I will tell you that as we've talked with our clients, we very much have seen that approach, that on some of the more basic elements, we saw that websites had not been updated, even to just say, hey, here's where we're at in terms of considering these pieces. So as we look at the new realities of where we're going on events, the realities as we're looking at reopening are substantial. We're looking at the number of volunteers we're going to need, and I will tell you internally, we wondered, would organizations come back and say we actually need fewer events? I think we're seeing, based on those events that are moving forward, many of them are coming back and saying we actually need more volunteers than we had before. It's possible that we're going to have smaller audiences, but it's going to take a lot more to make sure that the environment is handled appropriately. So whether it is the Be Smart, Stand Apart, and what are the elements that go into that? Are you putting signs on the floor? Are you doing posts in key locations? Do you have a social distance patrol that's walking around? And I was actually, as I was talking with Virginia a few minutes ago, we were talking about being in the grocery store, running into a friend, being 6 feet apart with our masks on, and the store manager coming over and congratulating us on our excellent social distancing skills. And so you could tell they were really trying to reinforce the positive, but also looking at, you know, how do we do this in a way that is, when people come to events, they want to feel good about being there, and they're excited and they want to share. But what does that new social distancing look like? And what are the rules? Are we communicating those correctly to our audience? But do our volunteers understand them also? And are we putting things in place in terms of barriers and plexiglass for our volunteers that are going to need, they've got extensive volume in front of them, and making sure that they're safe, and also looking at staggering, not just workstations, but everything, and making sure that those are appropriate. I am certain that all of you are working on establishing mask and glove rules. I'm sure you're looking at how you're going to train your volunteers on how to wear and remove. I think we've all seen the enormous amount of trash that is accumulating from all these gloves and masks. They're everywhere. I did a cleanup a week ago in a park, and that was the majority of the trash. Hand washing specifications, disinfection of all public areas, particularly those areas that are heavily trafficked. You know, the realities of this are, it's a lot. It's a lot to tackle. It's a lot to put into place. And so it puts new layers of what we need to do. And for those of you who have been through my trainings before, you know the biggest thing I emphasize is at the very beginning, we have to give job descriptions, establish exactly what it is we want people to do, and then we need to be very clear in establishing the guidelines and the protocols. So a lot of these things I'm saying, they may be obvious. You may say, yep, we're all over it. We're on top of creating our plan. But what we typically see is that sometimes we forget the volunteers as we're putting this together, and we make assumptions. We make assumptions that they know. We make assumptions in terms of our expectations, and sometimes we don't do a good job of training and reinforcing. And remember the rule, you've got to say it 7 times before it's fully absorbed. So that means that your leadership is saying it. If you're an event manager or a volunteer manager, you're saying it repeatedly. Your team leaders are trained on it. Your team leaders are saying it repeatedly. And you're just making sure that you're creating the proper expectations. And has this really been established in terms of how you're going to do it? So just things to think about. And again, for many of you, this may be the obvious, you may be all over it. And for others, you may be saying, oh, we haven't talked about this yet and how this goes into effect. And as we're looking at some of the biggest reemergence plans for some of the biggest events, we're seeing that they're really struggling with some of these. And I don't ever think it's easier if you're a mid-sized or small event. I think sometimes then it's even more challenging because you maybe don't have the volume or don't have the budgets to support some of these elements, so they become even more challenging to enforce. So again, just making sure that the expectations are clear and making sure that there's training, very, very clear training that is happening with this. This is an area I don't typically go into when we do our webinars, but we are now working with more events who have established medical teams, and they are registering those medical teams on TRS, and they may be people who are medically certified. They may be paying some of them, but in many cases, they are volunteers. They're volunteers who come from local health networks or people who simply have medical capabilities. And the challenges of setting up and making sure that you are approved for the medical side of your event really requires coordinating at 3 levels. The state level, understanding what the state requirements are, the county requirements, and then your local health officials, and making sure that they're included. Obvious elements may be thinking about, we assume people recognize the symptoms, that they know they're testing for a specific temperature plus, that we're looking for people who are having trouble breathing, we're looking for fevers, you know, these elements, but not everybody shows the same symptoms. And so making certain that we've got experts in the field and that we've put the items in place so that we're hitting those that are most obvious, that we're doing temperature readings for staff, volunteers, and vendors. Obvious, but maybe I've already heard from several organizations where they said, yes, but we didn't think about doing that during the setup period. We didn't think about doing it during the teardown period. We were just talking about at the event, and most of the discussion was really focused on the event participants. So are we really thinking more broadly in terms of the time span and making sure we're covering everybody? Also, as we're used to having first aid and medical care areas, we're not used to establishing quarantine areas. And again, during training with staff and volunteers, you know, really making sure that everybody understands what's the protocol if something happens, if we have somebody who's sick. How do we handle this? Just like you would train your volunteers for a lost child, just like you would train your volunteers for if somebody got sick normally, had a heat incident, or any of the multitude of medical challenges that we have. And then again, I think people get excited about going out and want to re-engage, but really reinforcing how critical it is that being part of the team means that you stay home if you have symptoms, or if you are feeling uncomfortable because of age, because of your general health, that we're not pressuring people into returning before they're ready. We make sure that they feel comfortable in returning before that stage happens. So what does that new engagement look like? So it may be that you've already set up some options online for virtual volunteering. It may be that you've already moved to doing virtual volunteer orientation. And you may have already had some challenges with those, or you may be expecting challenges with those as you move forward. Either because there's people, and I think a lot of times we talk about age being a challenge. I'll tell you, over the past few, particularly the past few weeks, I have seen people who are older adapt quite well to being online and Zoom. Did they need a little coaching in the first few minutes to make it happen? Yes, many times that was the case. But to be frank, I've also seen that happen with people who are younger, who just for whatever reason, going to online meetings and virtual opportunities, really a new challenge for them. Not used to doing that type of communication or that type of coordination. And as we look at the virtual piece, we've really seen some changes in terms of putting virtual volunteer opportunities online. I talked about the Pack the Pantries as being an opportunity where people could volunteer from home. Just pause again, and this is where the second poll would have come into place. The second poll is, do you have virtual opportunities? Have you done an assessment to say, are there things where we could change our operation and do things with fewer people in one place, with people spread out over a bigger geographic area, maybe working from their homes, or where we can partner on Zoom calls or whatever, if you're using Join Me or GoToMeeting or any of the different tools that are out there. Have we talked about this as an option? And we're talking about volunteers having vulnerability. You may have staff that are in a very vulnerable position where they feel uncomfortable in returning back on site at this particular moment. Maybe that will change. So how does that evolve? And I should mention, just on the virtual volunteering side, before the COVID outbreak, we already saw an expansion in terms of virtual volunteer emphasis. And I do want to talk about that just for a minute. We have seen over the past 5 years a huge increase in the number of groups that are volunteering. Corporate groups, charitable groups, church groups, school groups where you see high school seniors or high school juniors working together, college students, often again in groups. We went from 5 to 7 years ago looking at our group registrations being about 30% and the remainder, about 70%, being individuals. Today that is flipped. That is completely flipped. Today, and this is before coronavirus, as we were looking at last year, we were looking at about 70% of our volunteers being in groups. And that's of all ages. Initially, when we looked at it, we thought it was a younger dynamic. I would say it's even more prevalent the younger the volunteer is, but we are also seeing it with our seniors. This is very much, some people call it, the tribe or the herd, or there's a lot of different terminologies for it. But the reality is that it was already here before we got to this stage. So I think that as we look at changes that are going to be staying, if you haven't started exploring virtual volunteer opportunities, you need to. You absolutely need to. If this is all resolved tomorrow and we go back to the normal world here within the next 30 days, you need to be looking at that trend, because that is the reality of where volunteer experiences are going. So we're going to talk more about virtual activities here in a few minutes. But before we get there, I want to go back to the communication side. And this is kind of the step back to the beginning, some of the comments I made there. But if you've got a pad of paper in front of you, or you're typing on your phone, or you're typing on your computer, ask these questions. So have you been reaching out to your volunteers to say hello? Do they know you're out there? Do they have any idea what's going on with your organization? Are you asking if they're okay? Are you asking how they're doing? Are you telling them a little bit about what you're doing? If it's challenging and struggling, I would let them know that, hey, I'm sorry we haven't reached out. We're trying to come to conclusion on some pretty hard questions. You can imagine what those are. We miss you. We're grateful for you. We don't want to leave you out. You're an important part of our team. And if you can create some connections, if you weren't already, really looking at, can you do some event updates through email? Are they going to be the most critical decision-making pieces? No, probably not. But are they going to engage with, here's where we're at, here's the decisions we're trying to make, here's the questions we're asking? Because it gives your volunteers reassurance that you are thinking about the challenges. We've got some organizations where they are operational and they are actively looking at what the rescheduling looks like. We've got other organizations where the staff has been furloughed, or they are simply on leave while issues are being addressed. Some of them have seen major cuts in terms of sponsorships. And so from irrespective of where you're at, keeping in contact, if it's social media connections, sharing stories, sharing photos, keeping engaged become really great opportunities. As we're also looking at this, I was talking about groups. This is really an important time to be talking to your group leaders and to be making certain that you understand what is happening there. So I shared early on that we had some clients contact us. We also had some corporations contact us just to say, okay, how is this going to affect, this event? We're probably going to pull out of multiple events in the community because we are a health network. We're running hospitals. We need all of our staff back in the hospital. And one of our contacts from the hospital said, we've been kind of surprised. We haven't heard anything from the events we work with. We expected that they'd be reaching out and talking to us, but we had to go to them first and say, hey, here's our reality. And we were kind of surprised they weren't thinking that way. So here's the other reality. Hospitals, health networks might seem like an obvious one now. I will tell you that conversation happened in March. So it was relatively early, and I do expect a lot of events were sitting there saying, a lot of event managers were sitting there saying, I don't know what's coming next. So just a thought, really reach out to your group leaders and find out what the realities are within their particular organizations. They may be facing challenges you're not aware of. They may be facing massive layoffs. They may be facing extreme hours. It could be on any end of the spectrum. So as we're looking at the new engagements, as we're looking at the change in the way people may be volunteering. It may be that they're so busy that they can't come in to help. It may be that they're concerned about coming in to help. It may be that they're just simply taking a wait and see. I just want to be smart and precautions. Or it may be people who, quite frankly, they would really like to engage. And this goes back to the time before COVID. They would like to assist and they would love to do it online because they feel like they could bring more to the game. As you're IDing the potential virtual needs, I would start by working with your staff to look at each of the areas in your organization and to really break it down by each of your key areas. Maybe it's project management. You're looking at your volunteer infrastructure and there's projects that could be tackled on that front. Maybe it's public relations and basic communications. And can we pull in people who can really assist us with some of the external communications that we're doing and expand our network? Maybe there are influencers who could assist us with not just social media. I think we think of social media frequently, but other mechanisms to communicate information to large groups of people, schools, churches, charitable organizations, other corporations, and really look at public information in a new and different way. And I'll hit on that one again, just because I'm going to mention this is particularly from the corporate realm. We have seen corporations move to, rather than a top-down approach, an approach where there are groups, many times called ERGs, or there's a variety of different acronyms, but they may be women, they may be Hispanics, they may be the LGBTQ group, wide variety of people who have particular interests or wish to promote specific causes related to those interests that have formed within corporations. If you even look back 5 years ago, you would occasionally hear about it. Now it is commonplace. And as we're looking at really sharing information about our events, about our organizations, the importance of reaching into to those groups that may have an affinity, and that's typically what they're called, are affinity groups, that may have an affinity to our particular cause or our particular activity becomes really important. They may be a veterans group, they may be a Christian group, they may be a just wide variety of affinity groups within corporations now. So anyway, I won't go through all of these, but really look at what's the breakdown of your specific areas. It may be operations, it may be venue related, it may be very specific. But identifying what are the virtual needs within your organization. And I keep saying this because many of you have heard me speak on these webinars before or in person. And one of the things I always emphasize is please do not create busy work. Do not engage just to engage. Ask, are these real needs? Are these projects that have real return on investment for this process? Because if it isn't, then you're wasting your time. You need the projects to be meaningful. And I would recommend initially, if these are your first few virtual projects, do a few and do them well. And then look at, are these things we can continue? Did we learn from this? And do we want to expand? And the process is very similar to how you do project management if you're all in the same place. The volunteer may contact your organization You may put up virtual opportunities online, or maybe you're inviting people and you're not registering them. You've identified specifics in terms of what needs to be done, in terms of skill set, in terms of activities, in terms of specific projects. This is just like when you create your TRS sites and you sit down and you say, what are we going to have the volunteers do? If you don't, if you try and skip that process, that particular process, again, it generally will not go well because you haven't defined the direction that you want to go. You'll assemble your virtual volunteer team and kick off the project, just like you would if you were sitting in a boardroom and walking through the project pieces. And so again, making sure that you give it enough time, making certain that you're identifying how much time you're expecting the volunteers to put into it, because you want them, just like if you were doing shifts on site, you want them to have a realistic view of what are we expecting from you. And in terms of the number of hours per week, per month, the specific outcomes, how long do we expect this project to last? What are the deadlines? Just like you would in any work environment. And then once it's completed, that just like you would when you're wrapping up your event, you're going back and you're doing a wrap up on the project. Did that go well? Did it have good return on investment? Are you getting the outcomes for your event that was worthwhile in terms of the number of hours, in terms of your staff manpower that were put into it? So there's this reality that we are at, we're at the new normal. You know, we've got, I hate that term, but when we have crisis, it is an opportunity for us to evolve. And the reality is probably that we are going to see some things that were already in the works, whether it was virtual volunteering, whether it was moving some types of meetings and project coordination online. I suspect this will push that expectation forward in a major way, and that it will likely be continuing. Does it mean that we are not going to do events in person? No, I don't think so. I think that people like to be together, but we've just got to look at what are the expectations that allow people to want to come back together. So as you're looking at your recovery, I hope you will go back through and consider, and I will send out the poll questions with the follow-up email, just to go back and really look and determine how are you communicating? Are you communicating with your volunteers? As you're going through your re-emergence plan, are you looking at the volunteers every step of the way, just as you would have if you were adding new positions 2 years ago or 3 years ago? That you're defining the expectations, you're doing the training to support it so that they're clear. Typically, you're working in an environment where the vast majority of things are the same. In this case, as we move year to year, you may have more things that are different than the same. So volunteers are going to be looking for reassurance that they're comfortable in what they're doing. I think the thing that volunteers hate more than anything else is the feeling that they're not part of the team, they're not in the know, and that they haven't been trained to what the new expectations are. Is that challenging right now? Because you may have situations where the staff is facing those same challenges? Absolutely. So what I'm doing here is simply the reminder that we all need to make sure we're looking at those expectations, because if we don't cover those items, then we may have a real challenge in keeping the volunteers going forward. They may say that was such a miserable experience. I didn't feel like I was part of the team. I felt clueless. I'm not coming back. And that's the risk here. It's also the risk for staff. It's also the risk for vendors. It's also the risk for participants. But at the heart of it, many of our organizations are dependent on volunteers, and so critical that they are included in that mix. So from here in Indiana, where we're saying we're all in this together, and I know you are all in this together, want to take a moment and if you've got questions that you want to add into the chat, and then I can answer questions, or maybe I did such a good job that there are no questions, or maybe I didn't cover anything you thought was really important. So please, please add to the chat if there's any items that are big questions for you. Jasmine, I saw your message, so thanks so much. I will. We will send out the this recording. I will send out the poll questions, and I will also send out some of the surveys that we've been looking at. I will say normally I pull up the surveys and I'll start sharing, but I will tell you that many of them, I think it's too early, that there is really not enough information to share at this point. And I think that's that pretty well fits with what we've seen on other in other analysis. We see a lot of speculation across the board. Let's see, so I have a question, Flori, for non-event volunteer opportunities. Do you see those needing to be handled any different or the same basics? So that's a great question. So let's say that we have maybe things that are ongoing. So maybe you've got volunteers who are coming into food pantries on a day-to-day basis to help, or maybe you are looking at assistance at a hospice, or with many other charitable organizations. The basics are still the same. When we look at, and we'll be offering another webinar here in about 2 months when we get more back into the reemergence stage, of really emphasizing those key elements. Biggest focus is making sure that your opportunities are well defined, that you're really identifying skills that are expected, you're really identifying what you expect the volunteer to be able to do, and that you are training them on those items. And typically we see one of those two things or both of those two things don't happen, and that's when we see failure to bring volunteers back, and we see frustration from volunteer and activity managers that the volunteers aren't doing what they need to be done. It's typically because we as managers missed those first 2 steps. So very critical there. And that we're consistent in reinforcing as we go. And if things change, that we go back to that and we constantly refocus on, okay, something has evolved, why did we change it, and making sure that we're reinforcing. I hope that helped. And if there's something very specific that you'd like, that maybe you don't feel like asking the question here, please, you can feel free to send me questions afterwards as well. And more than happy to assist with questions. Let's see, any other questions? I will be taking the frequently asked questions from the first 3 webinars, and I'm also putting those up on our site. If you have not been out to the TRS site, if you go to our blog, you will see several articles that are supporting articles, more information on each of these items, everything from virtual volunteer opportunities to the reality of working through the coronavirus and items that you need to be concerned about. I know some of the people on the calls, TRS primarily supports events. We do support some ongoing activities. And so if questions related to the non-event side, again, please let me know. More than happy to share on that front. So I'll wait a few more minutes. I'm going to turn off the recording and I'll be on for a few more minutes. If anybody has any other questions or want to reach out to me, and if you'd like to share this webinar with others, just let me know, and you're more than happy to send out the links. So just want to say thank you to everyone. Thanks for taking the time today, and hope you enjoyed it, and hope you learned something.